everybody could, if everybody could mute your phones, that would be great. Hopefully we'll have time at the end for questions. So welcome to today's webinar, Benefit Design with your family in mind. So this is a webinar that really is designed to share interesting statistics that might help you build a business case for some of the things we're going to talk about today, but more importantly, to give you actionable items that you could take back either to your companies or to your clients if you're a broker or consultant to start advancing what we believe is one of the hottest topics in benefit discussions right now, which is the employee experience. So I'm joined today by three great companies, which I'll introduce here in a second. But I want to quickly walk through what we plan to cover while we're together. So during our discussion, we're going to talk about how to enhance employee experience, ways to leverage insurance products to improve financial well-being, and I'll share some stats on why that's really important. Addressing one of the leading pain points for working parents and working caregivers, which is having a major impact on whether employees can stay in the workforce, and fostering an inclusive workforce that ensures everyone has an equitable path to parenthood. So joining me today are three great companies that are going to lead each of these topics. Securian Financial, which is a thought leader and innovator in the insurance and financial well-being space. UrbanSitter, which offers a best-in-class caregiving resource, which one of the things I love about them is how their model enables equitable delivery of childcare and broader caregiving resources, and Kindbody, who provides a solution that provides all paths to parenthood through a hybrid model that includes not only a national network of providers, but also their own providers, which I think is really exciting. Just to tee us up real quickly as to why we chose this topic and why we think these are priorities for hopefully everybody on the phone. It's really around the importance of the employee experience. So I attended a conference last week where it was really refreshing because I've been in benefits for a long time, and I feel like most of my career has been about cost management. And what was so different about this session was it wasn't just the presentations from the platforms, but it was also the hallway chatter, was how excited everybody was that we were moving past a sole focus on cost management to how do we deliver benefits better? So how do we make the experience, something that causes employees to want to stay where they're at? And what is really interesting is that 92% of employers in this recent WTW study said that it is one of their highest priorities over the next 3 years. And at BenefitBump, we did a study of working moms, and this is why we think it should be a really important business imperative for everyone, is there's a lot of discussion around how many moms have dropped out of the workforce, or how many moms might drop out of the workforce, or even parents broadly, after adding to their family. But what we found in our study was 37% of working moms were leaving their employer, but 3 out of 4 were staying in the workforce, which means that they either feel like they had a better opportunity elsewhere, or maybe their employer left a gap that allowed somebody else to come in and convince them to work elsewhere. And so we're going to talk about how these benefits will really improve the employee experience. We think a great place to start is how do you make the benefits you offer work better? These are statistics from a Harvard Business Review survey of HR and benefits professionals, where employers have acknowledged that benefits are really hard for people to figure out and use. And this stat's kind of surprising. I think it was designed for a little shock value as to how low the percentage of employers were that believe their employees were effectively taking advantage of the benefits they offered. But arguably, it might even be on the high side, because I would guess that most of the people on the phone would probably say, we hope that people are taking advantage of our benefits, but maybe not all of them. And that's what we heard a lot and have heard, and part of the reason we exist is a lot of working families, a lot of growing families feel like they missed out because they didn't know everything that was available to them. But the other thing that really strikes me, and there's really great research, and happy to follow up with everybody on some of the studies we're reading, but we have to be mindful of situational stressors. So there's been a lot of emphasis on mental health in the market over the past few years. Probably a lot of you have implemented enhanced mental health solutions or tried to find ways to improve access. But the reality is that we're still kind of failing when it comes to addressing the underlying forces of stress. So things like life's logistics, things like financial considerations, relationships, things that ultimately path somebody towards the need for counseling. And again, I think that presenters today are going to really help us think about these topics in ways that reduce some of that stress and improve the experience for working families. So real quickly, why do we exist? So BenefitBump, we believe that we're that hub. We're the glue that holds all of these programs together. We work directly with participants, sponsored by employers, in a one-on-one relationship with our care navigators. And all of our care navigators are master's level emotional health professionals who educate participants on their benefit plans, help them get connected to the clinical support they need, provide well-being resources, which a lot are rooted in helping people address those underlying stressors, such as childcare, return to work considerations, the complexity of navigating time off, which is another core component of how we help support our participants. And why I share this slide, not just to brag about how great we think our solution is, but if you read the comments, what employees are saying is really echoing this need for greater experience. How often do we hear employees use terms like amazing and wonderful and hands down the best? Probably not a lot, because we focus so much on managing care or managing cost. And really what this is about is unlocking the value of the investment you're already making. And what it translates to is people being able to more confidently navigate their benefits, experiencing lower levels of stress, and really high return to work rates. And so, but these comments, in part, I'd like to believe are our solution and the great work of our navigators. But the other part is that employees now realize how great the benefits are that you all have offered to them, or you as advisors have encouraged your clients to offer to them, because now they actually truly are getting more of the value that was intended. So at this point, I'm going to turn it over to our presenters and have them help kind of lead us through a discussion around, not to recap the discussion topics, but to share them in a different way. But how do you provide equitable caregiving resources so people can effectively manage work and life? How can you provide affordable paths to parenthood and financial well-being regardless of that path, recognizing the pressure that families feel around financial concerns? And how do you reduce the stress they feel as they're trying to balance everything, pandemic or not? So with that, I'm going to turn it over to Darren Reeser, who's going to talk about financial well-being. So Darren.
Thanks, Scott. And thanks everybody for joining us today. As Scott mentioned, my name is Darren Reeser. I'm the Regional Director of Supplemental Health Products for Securian Financial. My goal is to work with consultants and employers in identifying opportunities to cover some of that exposure that Scott's mentioned, whether it be through product, technology, communication, engagement, solutions. But what I'm looking to do in our time with you today is first tee up a little bit of some of the financial challenges that families are facing, and they're growing. We know that. I'll talk a little bit about some of the other observations that the market has, and then we'll talk about some of the best practices or some of the opportunities for us to create solutions in that respect. But as you can see, the financial challenges are facing our families are growing, and the gap in insurance protection is too, especially among millennials and Gen Z. Currently, 50% of Americans now carry medical debt, which is up from 46% in 2020. And that's according to new data from debt.com. But more than half of those Americans, 57% of them, owe at least $1,000. But paying that $1,000 medical bill really proves to be a significant challenge, according to those same Americans in a report that was released by CNBC. So according to that report, 56% of them are unable to come up with that $1,000 out of savings or their discretionary income. So it's clear that the rising costs and inflation are also making it more difficult for Americans to save, let alone cover the increased exposure that they have. With childbirth noted as the most common reason for hospitalization in the United States, adding such a high hospital bill, on average around $3,000 out of pocket, on top of the already cost of bringing a baby home, could really financially devastate those families. Let's go to the next slide. So we know the importance of families also taken on, back one, I'm off one. Thank you. So we also know that the importance of family has taken on new meaning during the pandemic and what we just came through or what we're coming through. And in today's work environment, becoming a working parent is no small feat. Employees are navigating the stress of the major life changes while trying to understand the confusing, challenging employee benefit and leave program. So understandably, this leaves many of employees and recruits on the hunt for companies that are taking a really proactive approach to support family building through these broader benefits. So more than ever, the employees are looking for support across all those life stages. We'll talk a little bit about that in a moment. Balancing and integrating family and work responsibilities, offering meaningful and inclusive family-focused benefits can positively impact the employee's ability to succeed long-term, clearly going to your recruiting and retention efforts. But the financial exposure continues to grow, and that's kind of what we've seen recently. Over the last 10 years, workers have been faced with deductibles that are rising faster than the rate of inflation and their salaries, and many of you know this. But to illustrate, during that same period, the average family deductible in the United States has increased by 92%. Also, many of the benefit designs are covering less. So a unique hospital indemnity plan can help address that gap in coverage or that out-of-pocket exposure they might have. And not to mention, there's a significant gap in the employees that even have access to a hospital indemnity plan to help provide that type of maternity coverage or hospital care. According to Eastbridge, in a recent survey for 2021, only 9.3% of all the employers in the United States reported having a hospital indemnity plan. So it's obvious while hospital indemnity insurance typically has the highest utilization rate and has close to ties to medical insurance coverage, it's less popular than traditional critical illness and accident insurance products. If you go to the next slide, please. So what do we do with that? So there's a couple different ways to look at this, or several, right? If we start from a good standpoint, first and foremost, because there's such a low adoption rate, examine your current plan and how that it supports growing families and holistically across your benefit plan. Just have that discussion. Many plans don't even offer this type of care. Consider also using the widest definition of family and family building to be much more inclusive. And another good solution would be to evaluate your communication strategy for what you do have and optimize those solutions you have in place. Many of the employers we talk to and we work with have significant resources, but they're not connecting the dots across product families or across different technology that they can better educate their employees to make that decision about what's even available. A better alternative would be to just enhance your current plan with new benefits, specifically designed to cover the costs associated with family building. Add a hospital indemnity plan, because we know, we have very low adoption rate. And look at the decision support tools that are available through your benefit administration partner or that you have in your own system of record. But those really help communicate what those financial protection solutions are that you have and explain it in a more meaningful way. The best alternative would be help the employees understand how all of these products holistically work together, but also consider when you're looking at supplemental health benefits or things to cover that medical exposure that they have, those out-of-pocket exposure they have to deductibles, co-insurance, et cetera, consider where that sequencing is. So if you get to your health insurance product, are the hospital indemnity plans right behind that? So when you're family planning, you're family building, you're looking at maternity care, or you're looking at leave for this year, where are the benefits that support that in the benefit plan that your employer offers, that you offer? And are those positioned next to each other in a meaningful way? So while you're thinking about how am I going to pay for that, you've got those benefits right next to it. So knowing that 9 out of 10 employers don't offer a hospital indemnity product, employers need to confirm, first and foremost, is this worth implementing? And I think the message is, yes, it is. Also, according to the Eastbridge report from 2021, hospital indemnity is one of the top 5 fastest growing voluntary benefits. According to that same study I referenced, hospital indemnity sales have increased 8% year over year. So where it's made available, it's increasing, and those employees are taking advantage of that in larger numbers. So it is perceived as valuable. They're voting, employees are voting with their paychecks. These are generally discretionary, voluntary products. And so the trend is going in the right direction, but there's still a lot of opportunity. Let's go to the next slide, please. So about Securian Financial, the way that we look at this, we take a data-driven approach. And we start with the data analytic tool that we have called Secure Insights. It was developed in collaboration with LIMRA, and we analyze the employee population to identify opportunities to optimize your participation to help achieve that plan's full potential. The tool leverages LIMRA industry data about medical claims, experience, et cetera, discretionary income, third-party data, client census data, including your medical plan, your deductible, your coinsurance, your out-of-pocket exposure. And then it provides a report that helps provide a deeper understanding of the population needs, opportunities, and then where does that fit in with products that we might offer that could integrate with an employer's plan as well. It's really designed to provide a holistic view to identify the opportunities, set the goals, make decisions, execute changes to make sure that your plan, whatever that plan is, works to the best of its ability for your employees. Let's go to the next slide, please. So in closing for us, offering the highest level of all the resources to support both the employer and the employee experience from end to end is our goal. And we see that as our best practice, starting with our Secure Insights data analytic tool that we mentioned, looking at the population to identify opportunities, optimizing participation, and then achieving your plan's full potential. It's completed while ensuring the product and the plan design are best suited to match those employees' unique needs and giving them the tools by engaging them to send the right message at the right time through customized marketing materials and ensure that your employees are educated with decision support and our decision support tool that we also have called Benefit Scout. When it comes to submitting a claim, this is another thing we like to do is that we offer medical claims integration, new to the market. Many are going there. We're doing that now to ensure that employees are utilizing these benefits and to make that process easier for those voluntary suite of products and maximizing them to their greatest potential. Our approach also helps connect the dots end to end for employees during a really challenging, potentially confusing time. Employers have the autonomy to leverage Securian's resources. We have a significant amount of resources that we can provide, and it's based on the employee needs as well. So having that ability to successfully support both employers and employees through each step of this journey that we're illustrating on the graphic is what sets us apart. We're constantly looking for ways to add value to our products, make them meaningful and accessible. And some examples of this as well that we provide include BenefitBump, our partnership that we're here to talk about today that will be embedded in every hospital indemnity plan that we offer. Also expanding our definition of hospital. So if you're familiar with these products and you think about what the traditional definition of a hospital is, it generally goes back to the way that facility is coded. Securian is looking for ways to provide more alternatives for delivery. If you have a birthing center, if you have other places that might be a non-traditional setting, Securian is looking to expand our benefit so we can provide this hospital indemnity that would include a BenefitBump service with that to those that don't just deliver in a traditional in-hospital setting as well. We also provide full maternity benefits to mom and the newborn as well if you had a hospital indemnity plan. So those are some ways to provide more benefits at the time where those growing families most need it for that hospital admission. Last thing for us, if you want to learn more about Securian Financial and our products, you can look us up at securian.com, or you can reach out to your regional sales representative for more information. Scott?
Yeah, thanks, Darren. And so I was really excited, that you all presented with us today, because it is interesting that about a third of hospitalizations are maternity related. And in addition to employee experience, there's a lot of discussion about life cycles, benefits, or how do we provide benefits to, the different groups within the population. And so, so definitely see how hospital indemnity fits in. The thing that I find striking, and my one question for you is, if I go back a couple slides and I look at the secure insights, and this was something I commonly saw with my clients when I was on the consulting side, the gap for these age groups, where they're more likely to be growing families, working families, is always significant. So what are you all seeing as effective strategies employers can deploy to try to improve that insurance protection, that this particular group is likely?
Yes, great question. Thank you for that. So targeted marketing, and then we know that different demographics are going to respond to different types of materials. So really having access to a tool like this and understanding who's participating and who's not participating helps us send that targeted marketing at the right time in the right way, whether it's through a video link, whether it's through a PDF, whether it's through a brochure. But understanding those family demographics through our tool like Secure Insights and Benefit Scout really gives us the opportunity to send very specific targeted marketing in partnership with that employer to make sure they receive it at the right time in the right fashion.
Awesome. All right, thanks, Darren. So we will move next to UrbanSitter and Lynn Perkins to talk about arguably the greatest crisis we have for working parents right now, which is caregiving. So.
Scott, thank you for having me. I really appreciate it. I'm Lynn Perkins. I'm the CEO and co-founder of UrbanSitter. We are a marketplace platform that helps care providers and families connect. We help with childcare, tutoring, pet care, elder companion care, full-time nannies, you name it. And we started working with companies about a decade ago to also offer a corporate benefit offering. And I'm going to start off with some data. I don't want to dive into it too much because I know, Scott, you covered a lot of it, but you're spot on in that, we saw a lot of families really struggling with childcare during the pandemic because oftentimes it either prevented people from going to their jobs when schools were closed, or we could see kids running around on Zoom. And really that was a point in time. This is a problem that exists ongoing. It's a chronic problem, not just an acute problem. It just happened to be highlighted during the pandemic. But, as we come out of the pandemic, we're continuing to see this being a big stressor for families. And not surprisingly, 67% of employers surveyed actually feel that increased caregiving demands are a driver of mental health issues amongst their employees. And we're seeing this, even stronger now as we surveyed our population of parents, and they said that their number one stressor is actually juggling their home responsibilities with their work responsibilities, quickly followed by childcare as a very specific responsibility. So no question that this is something that is stressing parents out. As you mentioned in your survey, you found that people are switching jobs because they are looking for more flexibility, childcare benefits, and a way to balance everything. And I really like where Darren was going on the expense side. I do want to highlight that too on the childcare side. We have seen for the first time in as long as I've been in this business, we've actually seen inflation significantly rise, and yet childcare is still actually outpacing inflation in terms of the increase that families are spending. And so last year, our childcare rates that we saw on our platform rose 11%. And if you assume that inflation was up 7%, this is a huge increase. In the past, we've always seen childcare rise either in line or slightly below inflation. And it really impacts people disproportionately. We'll talk about this more. I like, Scott, how you touched on equity. What we're seeing is that for families with substantial means, they're spending about 10% of their income on childcare. But for those that are single parents, low wage earners, they're spending up to 34% of their income on childcare, and it's not sustainable to live while you're paying that much for childcare and trying to juggle all your work responsibilities. So this is a crisis that was really highlighted by the pandemic, but is ongoing. And I think employers are realizing now more than ever. I think I read a statistic in a Willis Towers Watson study that 40% of companies plan to add some sort of a childcare benefit that don't already have one. So this is definitely on people's minds. And so I want to talk a little bit about how we can focus on making it equitable and how we can focus on making sure that your company is getting the right benefit. And just a couple more stats here. This will play into a little bit of our discussion on, how do you understand if this is a benefit you should be offering? And looking at things like this stat, which we have across a larger population, but even surveying your own population, 9 work days were missed in 2021 by the averaging working parent due to childcare gaps. This wasn't due to a parent being sick or other unforeseen circumstances. This is specifically for childcare only, that 9 days were missed. And this adds up in terms of the productivity of that individual employee, but also the other employees that they work with are impacted. And 1 in 4 parents are currently experiencing burnout. I think this is no surprise. And as parents are looking at change, being able to offer them what they're looking for and to retain them is really advantageous for companies. And it's definitely a differentiator in a market where it's hard to find good talent right now. So what do working parents need? We surveyed our parents. We have hundreds of thousands of parent members, and they said what would really help is, number 1, offering a childcare benefit. We'll get into that more and what that might look like. Number 2, normalizing working while caring for a child. So having a company culture where it is okay to talk to your manager about your household responsibilities and working with your manager on figuring out a way to juggle both your work responsibilities and home responsibilities so you can be the best that you possibly can be at both. And then a third, I know this isn't an option for all companies, especially companies that have a manufacturing component or a distribution center component, but allowing flexible hours. So doing what you can to accommodate your employees' time needs will both attract new talent, but also highly promote retention at your organization. So what's the business case? Because I know this is going to come up, what is the business case for doing this? Well, as you mentioned, Scott, many new moms switched employers in the first part of returning to work in the first part of their child's life. If you can retain those employees, that is a win for the organization, especially as replacement costs right now are anywhere from 1/2 to 2 times your average employee's salary. Whatever you can do to retain your top employees, you should be doing. It's very hard to replace people right now. 65% are leaving due to poor work-life balance. And so where you as an organization can support them, you'll see that a higher retention rate. And I thought this was interesting, but half are now leaving due to a lack of flexible work arrangements. And so again, this isn't feasible for all companies, but where you can offer some flexibility to employee schedules or accommodations, it's very helpful. Employee retention. So I thought this was interesting. I took some of these quotes right out of our MPS from our clients. And one is that One Medical is a client of ours. And somebody said, just knowing that One Medical cares about you and your family, that helps. And I think there is a lot, especially as more companies are hiring millennials and Gen Z, there is a lot about the blending of how my employer treats me and my outside life. And so as an employer, if you recognize that your employee has this life outside of the workspace, I think that really helps. And then this was a great one. I know a lot of people here do engagement surveys at their offices or encourage their clients to do them. We do engagement surveys and look at the results. We get good results when employees are asked about our care benefit offering. And this is a great thing. I'm going to talk a little bit more about serving your employees, but just checking in and seeing how this benefit is helping with retention. And then talent acquisition. I know we all know that we're in this, we've seen this great move of employees from company to company. And one HR executive tells us our care benefit is great because it's something we can talk about when trying to hire people. It just fits with our other family-friendly policies. So definitely doubling down on family friendliness there. And then you don't have to just jump into the deep end. I wanted to stress that there are things as a company, especially as you're looking to free up budget for this type of benefit, there are things you can do that are sort of baby steps along the way. And the good here, I would again, I've said it 3 times now, but if you can offer schedule flexibility, it goes a long way. It comes up as one of the #1 things in employee satisfaction surveys. Provide subsidized access to a childcare platform. There is our service and others like ours where you can dip your toe in and offer free access to our platform for your employees. At that point in time, you aren't actually paying for their care. You're just allowing them to access a network of care providers. This is incredibly important because not only do families struggle with paying for care, they struggle with finding care. So anything that you can do to expedite your employees' process and finding good care is incredibly helpful. A slightly better version of that would be moving into a situation where you are offering them access to a service, but in addition, you're offering a subsidy for those last minute emergencies. I don't know that you need to do all 9 days that are mentioned as the average, but at least subsidizing a few days here and there is incredibly helpful to your employees. They're much more likely to use the benefit and much more likely to show up to work when they have this available. And then supporting a combination of paid time off with unpaid time off to care for a family member. So schedule flexibility is great, but when you can actually couple it with some paid time off, that really encourages retention. And then, if you want to go look at sort of the best, providing extensive paid time off for family care, offering a more generous subsidy that can be used to cover longer term care needs, potentially when a child needs to stay home for a week, things like that. And then we're going to talk about this when I focus on equity, but allowing employees to bring their own care provider onto the platform. We saw this really become important during the pandemic, especially as it relates to your workforce that's not located in a major metro area, and then including a center-based care benefit. So allowing your employees to subsidize some of their daycare or in-home daycare expenses. Again, I recommend just baby steps. You can start with one and work your way up. And I think you'll be able to prove the case of this benefit over time to your whoever manages your company finances, because I know a lot of times that can be a challenge. And then I do want to talk about equity. So this has become, and I'm thrilled that this has become more of a highlight, that when we're talking to HR teams or benefit brokers and they're asking about, okay, how can we create an equitable, we want to offer a care benefit, how can we make it equitable? We have a headquarters office in New York and Los Angeles, but then we have distribution centers outside of Memphis and in Southern Illinois. What can we do? So let's look at geography for a second. So in your major metro areas, almost all of the care benefits you look at are going to be able to cover the care that your employees need in those areas. It gets a little trickier when you start to move to these more rural areas or less dense populations. And what we found there is that employees in many cases actually have a care provider in mind. They have somebody, it can be a family member, it could be somebody in their community who does take care of their child when needed. And what we found is that when you can allow that employee to bring their own care provider onto our platform, we take all of the responsibility for the background checking. The employee's care provider has agreed to our terms of service. This is not sitting on your shelf in terms of liability. It goes a long way. And this is especially important when you have a population that is not comfortable bringing a stranger into their home, or perhaps they are, it is more in their background to use a family member. Allowing them to bring their current provider onto the platform and allowing them to use that subsidy goes an incredibly long way in terms of employee satisfaction and retention. We saw this happen during the pandemic with a large CPG company. They had a pool of essential workers and they really needed to get them all back in. And we said, hey, we really think in these rural areas, you should promote the ability for them to bring their own care providers onto the platform. And they did, and it was wildly successful. And then I would say, let's talk about care types. We've seen more pets purchased during the pandemic than at any other point in time. We have a lot of employees that are in the sandwich generation where they're taking care of younger children, but they also have aging parents. Look for a benefit that covers a wider breadth of services. So if you can find a care benefit that offers childcare, it offers household help, it offers elder companion care. You have people who have parents in other cities that they need to be checked in on. Look for a care benefit that is inclusive and will cover more of your employees' needs. And again, we'll talk about this in the next slide, but let's talk about, we can actually move to the next slide, Scott, and I can talk about, how do you know what your employees need? And I would highly recommend you start with an employee survey. This will be really important in identifying, like, what are your employees' major pain points? Where are they telling you that they are looking for care? And start with those big pain points first. And you might find that it's childcare, pet care, and senior care. Select the right partner. Look for a partner that is recommended by other HR executives if you need a place to start. And make sure that you and the partner are aligned at what success looks like. And then finally, this might sound obvious, but make sure that the payment method of the partner matches your use situation. So you don't want to find yourself in a situation where you're paying for care credits that are never used. And then don't be afraid to lean into some differentiated offerings. If you find that you have a population that's all looking for tutoring, doubling down on a tutoring benefit could be the right solution. And then finally, I want to talk for a second about, we can move to the next slide. And finally, I want to talk about utilization itself, because it's one thing, this is why I love BenefitBump, because I think benefit utilization is what actually leads to success. So let's make sure that your benefit is actually getting used to the max. So make sure you have a successful launch. Make sure that you and the partner are putting together relevant materials for your employee base. You're marketing these through all of your channels, whether you have a company interweb or you have a communication tool. Make sure you're getting the word out there. Ask the partner to do webinars. So for instance, we do webinars for new parents about best tips for finding care for your child. And those are very well attended and really informative for your employees. Educate your managers. Oftentimes with care benefits, the first person who learns that there is a need is the employee's manager. So if somebody needs to take a leave because they have an elder parent who is going to need some additional help, or they tell their manager they're pregnant, make sure your managers are educated on the benefits that exist, because oftentimes these come up at a point in time. And so maybe the employee was asleep at the wheel when you announced the new benefit and now they need it. Make sure your managers know. And then look for seasonal opportunities. Care specifically tends to have seasons where childcare, for instance, is very popular in the fall and in the beginning of the year when families' care situations are changing with back to school. And then make sure that your employee leave program mentions your care benefit. So when your employee is getting ready to come back, they know that it exists. And again, I love what BenefitBump's doing. I think the more we can get benefits utilized, the happier population we're going to have.
Excellent. Thanks, Lynn. So just quick question for you. So I know that a lot of employers are looking at creative ways to add benefits, and there are a lot of things that have been popular, some of which feel more like just other forms of compensation. But I don't know, maybe I'm biased, but it feels like subsidizing childcare has a greater like direct ROI to business, given that it helps get workers back to work or improves retention levels. So how would you help the folks on the phone build a business case for something that's atypical in terms of a benefit, but probably could drive significant employment outcomes?
Well, yeah, absolutely. And this is a challenge, right? If you're sitting here nodding your head during this conversation and looking at Darren's service and my service and other services, and you're thinking, oh gosh, now I'm going to have to go pitch our VP of finance. These are not in our budget for 2023. How do I get them in there? And I think one of the things you can do, I mentioned the employee survey. I would start with that. I would look at data. How many employees do you have that could be impacted by this benefit? If you look at the data that's out there between your survey and the surveys I mentioned here, 9 days a year were missed last year due to childcare. What did that cost your company, both in terms of that employee not being there and also what impact did it have on their coworkers? You can model that out. Companies like ours, and I'm sure Darren's can do this too, we can all help you put this case together to pitch to your finance team and look for indicators. And then once you've put your case together, then I think it's being very proactive and surveying your families at your company and making sure that they're both using the benefit and looking at what sort of satisfaction rating is that having, because then you can say, hey, listen, we have X number of employees who on average are making $100,000 a year. We saved this many days and we probably saved replacing 2 of them, which would have cost us Y. So constantly updating that calculation to make sure that you yourself want to make sure you're getting the most out of the benefit. So I think it's a good way to set it up to pitch to your team. I think using this good, better, best format that Darren and I have both showed here too. Hey, we can baby step into this solution. And then if it's wildly successful, we can look at upgrading it to the next one the following year.
Awesome. Thanks, Lynn. All right. And then our last presenter, Dr. Cezanne, is going to talk about family building benefits. So she was actually at an event that I was just at recently, and I think it might have been one of the first breakout sessions. It was standing room only. So happy to bring her remarks to this group as well.
Well, thank you so much, Scott. It was a pleasure to meet you in person. I feel like we've changed the way we work, and you're rarely seeing people outside of the box. So it was nice to meet you in person at that conference. I am Dr. Fahima Sassan. I'm a board certified OBGYN. I am Kindbody's founding physician and our chief innovation officer. It's a pleasure to be here with you today. I really enjoyed listening to Darren and Lynn, and I think this all very synergistically fits in together. And so my piece is really talking about the benefit as it relates to building those families and meeting the needs of your workforce today, recognizing that the quintessential American family now looks like every color of the rainbow, and is no longer comprised of a man and a woman and 2 children and a dog and a picket fence. And so why this is so important and why I, as a founder, feel so passionate about it are some of the statistics here. Before I go into what's on the slide, I just want to talk about the fact that, for example, 1 out of 8 women in the United States get diagnosed with breast cancer. And think about all the awareness, right? Every single one of our companies has breast cancer awareness events. We hear about it all the time. There's national walks. There's so much funding. And now look at these statistics. 1 out of 3 women will struggle with fertility issues when they're over the age of 35. And 1 out of 6 heterosexual couples will struggle to conceive. But then more importantly, 77% of the LGBTQ plus community actually now wants to have biological children, whereas it used to be that the family forming path for LGBTQ plus community was predominantly path of adoption. It is now a desire to have biological children, and that biological children come from fertility services. And so this has now become, and why it's so important to have this conversation, I'm so delighted to be here with you guys, is that this went from a benefit that was a nice to have, that was a perk that was available to the top 1%, that used to be a predominantly cash industry, to now a must have. And maybe the most important statistic that's on this slide is that 61% of women now will have a child over the age of 35, whereas just a decade ago, it was only 8%. And why this is important, and I'm stressing it as an OBGYN, is that as more and more women wait to be over the age of 35 to have 1 or all of their children, they're going to have more fertility issues. And if we don't take a preventative and proactive approach to this, it's going to increase costs. And not only that, but increase the emotional distress and anxiety and workforce issues that we have based on those struggles. So next slide. And so what are some actionable employer insights? So what can you do? And so delighted there's so many of you here. But important factors, just as Lynn and Darren talked about the percentage of people that actually care about these benefits, when it comes to family forming, it's no different. 68% of employees will switch jobs to gain fertility benefits. And this is becoming more so today than ever. And why it's so important is that it used to be, when Facebook and Google came out, that they covered egg freezing, it was like revolutionary, and people were like, only like rich companies like them can afford it. And actually they even got some backlash because they were saying that you're trying to chain women to their desks. But what they were really doing was being very forward thinking and understanding that it's not that offering egg freezing is going to somehow harm a woman's ability to have a family, but in actuality, they're allowing her to advance her career and focus on what's important for her at the time. In addition, 62% of employees and with companies that have some sort of fertility benefits are more likely to stay longer. This is a benefit that can actually build loyalty. And here's why, because nowadays it's very standard. You have to look hard and far to find a job that doesn't give you major medical, vision, and dental. It's pretty standard. Everybody has them. It's these unique benefits that my colleagues and I are talking about today that can actually develop and build loyalty. Like, oh, wow, this company isn't just looking to kind of get me through my first month of working. They're thinking about my desire to have a family, about my childcare, all the different facets of what we've discussed today. And then certainly they're grateful. So 70% of employees that have full fertility benefits are much more grateful. Hopefully that's pretty easy to understand. If your company is going above and beyond, you're going to be really pleased with that. And then I think the last piece of this is just understanding that unfortunately we have an incredible amount of biases in our society, and certainly racial disparities, socioeconomic disparities, and disparities when it comes to the LGBTQ plus community. But specifically, and it always gives me chills as a physician, but African American women are twice as likely to experience infertility issues, and yet they're 50% less likely to be referred to a fertility specialist because of fertility biases that exist, where even physicians will assume that an African American woman is more fertile than her white counterpart. And it makes me truly sad as a woman and as a physician, but this is what we're dealing with within our society. And that's why it becomes a really actionable opportunity for employers to do right by the men and women who serve us. All right, so meeting organizational goals become really important, and I'll touch on 4 pieces. Certainly diversity and inclusion is now a must, right? It's 2022, and that D&I and equality becomes so imperative. And what I think particularly happens when we talk about fertility benefits is that we assume that what we have is equitable and is providing the similar amount of access to all of our population. But here's what happens in reality. And this is never intentional, and I really want to stress that. But sometimes you think, oh, well, we have fertility benefits. They're fine. They're through a carrier, or they're through so-and-so, or they've been in place for years. And what I want to highlight is make sure that you, on a regular basis, do an evaluation of your current benefits to make sure that they're still as equitable as you intended them to be when they were created. So a really good example of this is the city of New York, and this is all public data. I'm not trying to bash anyone, but the city of New York actually just got sued just in the last 2 weeks by a former assistant attorney general of the city of New York. It was a same-sex male couple who were not able to utilize their fertility benefits, which the city of New York has fertility benefits. It's actually a state mandate in New York to cover at least 3 IVF cycles. But because their benefit design stated that the couple must have been trying for 1 year unfortunately, through heterosexual sex to achieve a pregnancy, that unless that criteria was met, they would not qualify for the benefit, which obviously as a same-sex male couple, they cannot try for a year, not even 100 years. And so they were not able to utilize their benefit. I assure you that was not the intent of the city of New York, that they were trying to discriminate against this couple, but inadvertently it happened. And now they're facing a lawsuit, and obviously the outpouring of bad publicity that comes from it. And so it's really important. Also, talent acquisition and retention, obviously. And that comes from, this is not an LGBTQ problem. This is not a female problem. It becomes a universal problem. The desire to have children, the desire to have biological children is a universal thing. And it affects men equally as much as it can affect women. And so I want to also stress upon you that even if you feel like, oh, our workforce is predominantly male, that doesn't mean fertility benefits don't relate to you. And then obviously this third-party assistance and the need for a population that actually must have resources in order to have biological children becomes so important. And it allows you to really be partners with your employees in an intentional and proactive manner. And that's what I really want to highlight. So let's go back to, I love this good, better, best model. So thank you, Scott, for putting it together. So first and foremost, let's talk about the good. The good is first just doing an evaluation. And again, I implore upon you, even if you have benefits, to just take a few moments and take a look at them. So what's our family building strategy? Do we have any benefits? Maybe you just don't have benefits and you felt like you were too cost sensitive to have them. Exploring options and recognizing this isn't something that has to break the bank. And as a matter of fact, there was a Mercer study that showed that 97% of employers who added fertility benefits did not actually see an increase in spend. And the reason for it is people aren't waiting for their company to have a benefit in order to seek this care. They're just probably coming through other channels, and this just allows it to be easier. Also recognizing that at the end of the day, even though it becomes so crucially important for that member who's using it, it's not like every person at your company is going to be running to use fertility benefits. The utilization we find tends to be less than 1.3%. The next is, what are you hearing from your employees? And really listen. We have seen an outpouring or an outcry of demand from different aspects of employer markets wanting egg freezing benefits, or looking for LGBTQ plus benefits, or looking for adoption benefits. But really listening to your employees and making sure that you get a good gathering of a variety or diverse group, and not just listening to maybe your executive team, but actually listening to everyone. And is your current coverage equitable? So I think the City of New York example I gave is really important. And just making sure that there aren't certain medical necessity or requirements within the plan that are inadvertently making it discriminatory. And then having leadership support and talking to leadership, and really bringing someone like a Kindbody to the table, just to help you understand and explore what this benefit actually means, even if you're not ready to execute upon it. So number one, the first part is just a lot of self-exploration. I think that's always important. The better would be to make some immediate improvements. So first and foremost is removing barriers to access, that unintentional discrimination I was talking about. So simply by removing within the benefit plan that a person must have been trying for a year can open access to a whole community. Or taking away some infertility diagnoses that I as a physician can tell you have become archaic. The next piece is expanding services to support all paths to parenthood. And a lot of times I'll speak to companies and they say, oh, well, we're okay with covering IVF or fertility benefits, but we're not going to cover adoption and surrogacy. And recognizing that, my goodness, that just in itself, as I finish the sentence, hopefully you're like, oh gosh, yeah, I see what you mean. And now no one's asking for an employer to pay, adoption is expensive. It can go upwards to hundreds of thousands of dollars sometimes to adopt. No one is saying the employer should cover the whole, but you can make it equitable, where if we're covering this much for IVF, we can at the very least cover the same amount or a similar percentage. Recognizing, again, the number of your employees who are actually going to adopt a baby is not going to be everyone. And so that spend isn't going to be as astronomical as maybe it seems as I'm talking about it right now. And then starting to evaluate vendors who can improve your employee experience, and recognizing that experience when it comes to healthcare is one of the most important aspects, right? I always say as a physician, 3 things matter in healthcare. It's outcomes, obviously, it's medical science, the patient experience, and obviously the cost. But really looking at your vendors and saying, okay, I've always done everything through maybe a carrier or through X vendor. Are there other vendors out there? And I think we should do this with all of the vendors that we choose, and to not just always stay with the status quo, but to come constantly looking to reinvent. And then evaluating your own medical spend and understanding what are high costs for you. And this is an exercise that we love to do with employers, is sitting down and saying, bring us your claims. If you have really astronomical NICU spend, how can we reduce those? Maybe you've had really high C-section rates. How can we help reduce those? Maybe it's neither of those, and you've actually had high readmission to hospital postpartum period. How can we help improve that? So it's really understanding that when it comes to these types of benefits, it doesn't have to be cookie cutter, and it certainly is not one size fits all. And that we're looking and demand that your vendors be partners as you explore these, and challenge them to tweak with you to make it what works right for your workforce. And then best would be implementing a best-in-class fertility and family coverage, providing benefits that are above industry benchmarks. So if everybody's covering IVF because their states mandate it, now I believe it's up to 20 states that mandate IVF coverage, take it a step further and say, you know what, I see the value of a woman freezing eggs because she wants to be an executive in our company, and this will allow her to have a child in the future. And sometimes even thinking about elective coverage, recognizing that it doesn't have to always be attached with a really high price tag. And then offering programs that truly support the whole person and all paths to parenthood, and not looking at fertility as a transactional, okay, it's a prescription, you're going to go fill it and be done. That fertility can be a journey, that it comes with pregnancy loss and miscarriage and the mental health aspects of having a fertility or infertility diagnosis, and all of the avenues that play together. And that's why I really value what we bring to the table at Kindbody and kind of a 360 approach, we say, and that we're not just transactionally looking to take care of fertility, but looking at nutrition, mental health, risk reduction, so that we can actually improve your NICU costs and C-section costs. And then removing fragmentation. I mean, my goodness, there's 67 people on this call right now. There's so many solutions, and I feel like at some point we're going to get exhausted with like the 100-point solutions that an employer has, and really trying to see where can we remove fragmentation? Where can we bring in maybe 3 vendors that can do the job of 5? And are there areas where there can be overlap or synergy? Because the more fragmented it is why I think it leads to such a low utilization of benefits. Because if you have like 100 different benefits, no wonder people don't use all of them, because at some point you just get kind of lost in the crowd. And then finally, implementing and demanding that your vendors work together in an ecosystem approach, so that they're not all living in silos. But for example, Darren, Lynn, and our platforms should be working together, right? So that it's almost a warm transfer from one to the other. Next slide. And so curating a benefit, and again, this is all things that we at Kindbody really like to do on a one-on-one basis, and I won't spend a great deal of time on each and every one, but looking at cycle benefit designs and understanding you can do cycle-based versus dollar-based, obviously inclusive and equity and access we talked about, that continuity of care becomes so imperative. And then the ecosystem, values and outcomes, and knowing that you can add a benefit like a fertility benefit without breaking the bank, that we can work with you to make the subsidy what works for you. Or maybe it's just even providing at the very minimum discounts and access to the care, even if you're not in a position to put forth an incredible amount of money behind it. I realize we only have 2 minutes, so I'm going to hand it back to Scott and so that we can wrap it up, because my goodness, I apologize if I spoke too long, but Scott, I'll hand it back to you.
Yeah, no, that was great. And I know we're down to our last minute. And so I appreciated your last comment around needing somebody to pull it all together so it works well. And so that is why we exist at BenefitBump, is folks need help knowing kind of what to do, when to do it, and how to get things done. So maybe just quick question for you. There's so much attention to family building benefits. I think you gave a great roadmap of things for folks to consider. But what is it that you all are learning from having your own providers that maybe others haven't realized yet? Or what is it that you're able to influence through more of a vertical model?
Yeah,
like to share?
One of our new kind of taglines is "Fix Healthcare by Direct," and the reason behind that is, I alluded to it before, especially when it comes to the practice of medicine, and I think uniquely, what we're providing is actual medical care. And so when outcomes matter, when cost matters, and patient experience matters, it's really hard to effectuate change when you just go out into the community, because at the end of the day, doctors' offices, fertility clinics are not different, are mom and pop shops, right? It would be like going into New York City and telling all restaurants that starting tomorrow, you have to all do this same thing because we find that customers are happier when you have this. It would be impossible. And so what we want to do is really think about the consumerization of healthcare and bringing the patient first, that this shouldn't be a shrine to me as a physician, but I'm here to be your partner as a patient. And if we can do that on a patient per patient level and bring that to the larger employee benefit space is I think an opportunity for us to really revolutionize healthcare delivery. So that would be my short answer to that.
Well, I know we're out of time. We didn't end up having open Q&A. Hopefully folks were able to post some questions to the chat. We will post a recording of this session for everybody and send the presentation out. And then if anybody has follow-up questions, please reach out to me at scott@benefitbump.com, and I'll work with our presenters to get the answers and distribute those to all of our attendees. So thank you to our presenters and all the attendees. I learned something every time, so I hope it was helpful to everybody else. Have a great day, everyone.